Hey everybody, my name is Dr. Cort Lohff. I'm with the Southern Nevada Health District, and I'm here today to walk you through a short video on how we would recommend homeless service providers to screen their clients before entering their facility. Our screening tool uses two very simple questions. First question is, have you felt like you've had a fever in the past day? The second question is, do you have a new or worsening cough? Any client that is screened positive for one or both of these questions, we set aside. The idea there is that we don't want them in the general population where they could potentially infect other people with this virus. So first thing we're going to do is talk a little bit about the PPE requirements for your staff who are doing the screening, and then we're going to do a quick walkthrough of our protocol. So the first thing we're going to do is to show you how to properly put on PPE or personal protective equipment. In our protocol, PPE is limited to a face shield and a face mask, and I have Sarah Lugo, who's one of our community health nurses, going to demonstrate that for us today. Sarah? First thing Sarah will do is put on her face mask. This could be of any type of face mask, and N95 is not necessary. She's making sure that it's tightly fitting as possible, and then secondly, she's going to put on her face shield. And again, the face shield and the face mask in combination helps prevent exposure to the eyes, nose, and mouth, which is a primary way that the virus can enter a person. Okay, next we're going to demonstrate the actual screening process. You can see we have our two tables here set side by side. This is a way to promote some distancing between the clients that are being screened and our screener. We also have the screening questions both in English and Spanish as a way to aid or to help your clients understand what the questions are. Again, we have Sarah here, who's going to be our screener, and we have Kashana, who's going to be our pretend client today. So Kashana, you want to come up?
Hi, good afternoon.
Good afternoon.
We're screening for coronavirus today. Have you felt like you've had a fever in the past day?
No fever.
Do you have a new or a worsening cough?
Nope, nothing good.
Okay, wonderful. Have a great day.
You too, thank you.
And of course, if the client answers no to both those questions, they can come into the facility. If they answer yes to one or both questions, then we recommend that the client be given a face mask and then be escorted into an isolation area. Okay, and our last step in this training is we want to demonstrate how to properly take off the PPE or personal protective equipment, and then for the face shield, at least how to properly disinfect that. So Sarah, again, is going to help us demonstrate that. So before she does that, just want to make sure that folks set up what we call a donning doffing station, just a simple little tray that has paper towels and whatever disinfectant that you might use. In this case, we're using a bleach disinfectant. Just want to make sure that whatever disinfectant you do use to disinfect your face shield, that disinfectant is approved by EPA for killing of the coronavirus. And then secondly, make sure you look at the label to see exactly what the contact time is for your disinfectant. Contact time meaning the amount of time the disinfectant needs to be on the surface for it to be properly effective. So Sarah's going to take it away here. Sarah? First thing Sarah's going to do is apply some hand sanitizer to her hands. Secondly, she's going to take off her face shield, and as you notice, she's grabbing the face shield by the band in the back of her head, being careful not to touch the inside or outside of the face shield itself. And then secondly, she's going to take off her face mask and put that into the garbage. Again, noting that she's grabbing the strands on the back of her head and not touching the mask itself for fear of contamination of her fingers. Then lastly, she's going to demonstrate the process for doing the disinfecting of the face shield. Here she's applying a pair of gloves. Next, she's going to spray the disinfecting solution on the inside of the face shield and then let it sit for the proper contact time. In this case, it's 1 minute. After the 1 minute's up, she's going to take a paper towel and just wipe the surface of the face shield to dry it out. And then she would turn the face shield over and do the same to the front of the face shield as well. Again, making sure that you let the disinfectant sit on the surface for the proper amount of time to be able to disinfect the surface properly. And after the 1 minute, in this case, you'll proceed with wiping the face shield as well. And then lastly, Sarah's going to demonstrate how to take off gloves. You want to grab the inside of the glove as she does, and then again, grabbing the inside of the glove and pulling it inside out. Thank you everybody for viewing our video. For more information, please visit our website.